Hello, everyone, and welcome to the Happiness Journey with Dr. Dan, where every journey is worth living. My name is Dr. Dan, obviously, and I'm your host for today's podcast. I'm a psychotherapist as well as I am a counselor, marriage counseling, etc. And also, I'm an inventor, an author, and so on and so forth. And today, I'm very, very excited because we have my second guest. It's her name is Carrie Leaf, and she's an author of her upcoming book, Therapize Yourself, and she's going to give us a little bit more details about who she is and what brought her to write this book, and also her past experience on how she was able to overcome any challenges that she had to be able to achieve happiness. Carrie, welcome to today's podcast.
Thank you so much for having me. I'm honored to be here.
So tell me a little bit about yourself and tell me what brought you to write this book.
Yeah, sure. Well, how far back should I go? So I'm a psychotherapist as well, shifting and combining some mindset coaching and hypnotherapy. I work with individuals, couples, families all across the board. Master's degree is in marriage and family. So I really take a systems approach. And so I've been working in the psychology field and counseling for, between 10 and 15 years now, ever since I was even in my undergrad. So what led me to writing this upcoming book, Therapize Yourself, it was just kind of a spill out of all of the things that over, these past 10 to 15 years, I have found myself repeating over and over to every client, no matter what they were coming for. It didn't matter their issue or what they were working on. There were some basics that we were going to start with, and there was some approaches that we were going to take no matter what they were working on, so that we could achieve better well-being and more happiness in their lives. And so that's what this book ended up being, was those things that I kept repeating over and over to all my clients.
So do you feel, based on the title of the book, Therapize Yourself, so do you basically teach people or your patients on how to be self-sufficient?
Yes and no. Okay. It's kind of a combination, in the sense of the book walks through my assessment process and the fact that I take a holistic approach. I'm really passionate about, looking at mind, body, spirit, and integrating all three, that, they're so strongly interconnected that we can't ignore one and think that we're going to feel balanced and well and happy. And so the book kind of walks through what I'm looking for. What questions do I want to know? What areas of their life do I want to look at? Each environment, the scans that I take. So it helps my clients to walk themselves through that as well. They can read this book, they can walk themselves through that. They can check in with themselves, do their own little, mini mental health assessment. Where am I at in this area of my life? How am I doing here? Am I getting enough, exercise and sunshine? Am I talking with my friends? How does my house operate, my household? They can check in with themselves. And then I kind of walk through the process of, okay, when we get that strong foundation of well-being, maybe we feel balanced and grounded, then we can deep dive into some of the deeper level issues, kind of what I like to, my forte with my mindset coaching is in therapy as well, but the identifying those negative belief patterns that might be holding us back in life, then we can dive into those. And in the book, there's a point where I'm urging people to jump in and get some guidance and get some professional help and have somebody work with them through that. I think that we are our own best self-healers, that ultimately we are healing ourselves. Nobody has the answers, that we have within, but professional can help you guide through that process and get there. So it's a little bit of, yes, therapize yourself, and in a sense of, you doing it on your own. And it's a little bit of therapize yourself and get into therapy and get some help too.
Excellent. Now, how in your book, do you discuss how you connect body, mind, and spirit? Do you give strategies like practicality behind all this, or is it mostly theory?
A little of both. I do go into some, examples, some details of the basics, like I said, 7 to 9 hours of sleep, getting on a routine that you're waking up and falling asleep at the same time, things that are just good for our body, getting some movement, but that's going to be different. That's really individual. That's going to be different for everybody. Some people, if you haven't worked out in 3 years, I'm not going to go tell you to run a marathon tomorrow, and that's good for you. And different types of exercises, and foods and all of these things are good or bad for different types of bodies, so yeah, there are some basics of like, yes, check into these areas, and then spirituality, the spirit, that's a big vague one. So of course that one's going to mean a lot of different things to different people as well. Are we talking religion? Are we talking life's purpose, worldview, system, beliefs? Like that's going to mean a lot of different things to different people. So there are some basics to start examining those areas that I'll walk through. But at the end of the day, that is also why jumping into, professional help with somebody it's going to be more of a tailored approach as well, because these things they're not one size fit all. They just aren't.
I agree. That's true. And what brought you to become a therapist? I mean, for everyone, we have like specific desire to achieve in our life when it comes to professional, what brought you to wanting to be in this field?
Yeah, I have known that I would be here since I was in middle school. I think part of that was growing up. My dad was a high school guidance counselor, and he was a professor at the community college, some here and there. So that is just what I was raised with. So that was, my air quote normal, right? And so I was used to that, but I kind of was geared that way early on, just with my upbringing. But then I think that there was also a click in there somewhere, probably in high school, which led me specifically to marriage and family as my master's program, was that idea of I just didn't see what could be more important in this life than relationships, whether that was friends, family, or, a very important one, the relationship with myself. How do I treat myself? And so when that clicked with me, that I just didn't see what else could be more important than that, that solidified my direction down this path.
And you said that you've been practicing for the past 10 years?
Yeah, yep. I've been let's see, when did I out of grad school for over 10 years. And then even through undergrad, I was working in, this in psych units in the hospital. And so just been in the field for a long time.
Good. And what would you say was your most challenging patient? Without giving names, I understand confidentiality, but what was the one that really put into test your knowledge and your practice in that field of psychotherapy?
Yeah, I think that I'm grateful for my experiences in a wide variety of settings. I've worked in community mental health. I've worked in residential treatment. I've worked on, military base, substance abuse, all along the way. And it's, shifted and geared to me to where I'm at. Some of the most challenging ones for me, and challenging, I just want to clarify, I enjoy it. I really, really do enjoy it. But I think at the end of the day, some of the more challenging ones for me are either your more severe, like schizophrenic, or also a diagnosis of borderline personality. Those have been challenging for me. And couples are very challenging. Yes. Working with couples. I enjoy it. Yes. But as soon as you add another person into the mix, there's a lot more to attend to, right? Naturally. And so that couples are very challenging.
It's actually a little bit like DID, dissociative identity disorder, when one person has multiple personality, just like couples. You're dealing with a lot of them. So that's definitely
exactly.
And in your book, you write about something that whatever your problem is has most likely been there for a long time. So you talk about family addiction. You talk a lot about how to handle, or do you mention anything about meditation, on how to self-heal? Or this is a subject that you have not really covered in your book yet?
In this book, I briefly talk about my holistic approach, and when that comes to medication.
No, meditation.
Oh,
Yeah,
meditation.
meditation.
Okay.
Yeah, no medication. No. This is, I know it's holistic, so you stay away from any of those drugs out there.
If I can, yes, yes. Holistically, meds are my last resort. There's a love-hate relationship there, but yeah, they are. So meditation. I don't go too much into meditation in the book,
Okay.
but there's some little examples there when I start walking through coping skills, or yeah, the spiritual side of things, what that means for people. Maybe it is meditating, maybe it's going out in nature, maybe it's going to church, whatever it is, I want you to tap into it. But again, that's going to be different for everyone. For me, meditation is often in the form of a walk, mindful walking. And I know a lot of people imagine meditation sitting down, legs crossed and
Yes.
in complete silence and void of all thought or something, on top of a mountaintop. And so I don't go into that in specific depth in the book, but absolutely talk about finding what works for each person.
And during session, would you, if someone comes to you and tell you, Carrie, I would like to start meditating, what is the best approach, or how can I start doing this? Do you give them like a certain guideline on how to get started? Because I myself, I've been meditating for the past 5 years. Okay.
Good, yeah.
And but I do it in a specific time of the day, because this is also crucial. Just like eating, what you eat, when you eat it, this is really crucial when you do actually your meditation. And what I found to be most productive is to be able to meditate when you're about to sleep. And here's why, is because I have seen where, the strategy that I give actually, Carrie, is you basically record yourself like positive messages, and you play them when you're about to go to sleep. And they play all night long. So your subconscious mind actually absorb the positive information. And then the next day you feel more, I don't know, more energetic, happier. And these are the strategies on what I try to implement to all my patients, because most of them, they say, Dan, I don't have 10 minutes to sit on my butt and just think of nothing and then wait for something good to happen. And as you know, Carrie, meditation, you need to do it for 10, 15, 20 years to start really seeing positive results.
Yes. I actually, so when a client does come in, I walk them through a similar guidance, in the sense of I'll either do some guided meditation in session so they get a feel for it, so that they understand. Otherwise, yeah, I suggest with guided meditation, because it's not that easy to just jump in and think that you can get the hang of it. People will be like, this is so hard, and they'll jump out in a minute.
Correct.
A minute later, they're like, I can't do this, right? So I do suggest doing some guided meditation, and like you all say, right before bed,
Mhm.
so that that's that right in that point where you think you could fall asleep, but you're not asleep, is where you're
Yes.
getting that in the subconscious the
Correct.
most, right? And so I'll just tell them to put on some headphones, so you got your little bubble at least, and pull up a YouTube for whatever you might want to focus on. Maybe you're meditating, and you want to work on anxiety, or maybe positive thoughts or whatever. And yeah, there's just so many to pick from. I also encourage them to pick the same one, and do that same one over and over. That repetition that drills into our subconscious is key.
Interesting. Do you think people are showing a lot of reluctance in hypnosis because they're afraid that the psychotherapist goes into their mind and mess around with it? Have you seen any resistance to it?
That's what my husband says. Yeah, he won't let me do it on him, because
Okay.
he's like, I don't know what you're gonna do in there. But I would say I see some resistance, but I also see people wanting to use hypnotherapy as that quick magic, quick fix,
Okay.
and wanting to thinking, okay, I can just come in here and do this hypnotherapy, and I don't have to do any other work. And so that's another side of it that I see. And we have to have some discussions around that.
Okay. Have you ever seen the movie Office Space?
Yes.
Okay. And he got hypnotized, and then the next 5 minutes later, he felt like nothing bothered him anymore. Now, how many sessions does it really take for whatever message you incorporate in someone's mind to actually start to take effect?
Oh, I mean, I believe that can be one. I think that there's a level of it just like anything, like just if anybody's walking into therapy, there's got to be that level of openness and willingness. If I'm shut down or avoiding, I could come talk in therapy all day, every day and get nothing out of it. Right. So it depends on where each person is at. But with my, hypnotherapy done on me and me doing hypnotherapy on others, I've seen results in one session. Now, if we want them to last and we want them to stick, I recommend
Right.
following through with it further.
I see. And what was your biggest success story when it comes to your patient? When it comes to, let's say, because I have seen people coming to me for suicide prevention, anger management. I deal a lot with that. What was your biggest success story?
I don't know if I could say biggest, because different things are going to mean different things to different people. But it feels really good when I see people quit smoking, and they come
Okay.
in and, they message me and, I haven't smoked in X amount of months or years since I saw you. And that just makes me happy, like, to know that, mind and body, they've made some serious changes for their health in that sense.
Was it through hypnotherapy or was it through like just regular psychotherapy?
Yep, hypnotherapy.
Hypnotherapy. Okay. Have you done with alcoholism as well?
That one I have not, no.
Okay. So what is your definition of happiness, Carrie?
My definition of happiness boils down, that's a really big question, right?
Yes.
But for me, it's knowing myself and feeling like I can be okay and love myself and be myself, my authentic self, show up as my authentic self in this world and get to live in my fullest expression. And that to me is happiness and gratitude.
Mhm.
Making sure that there's a lot of gratitude. I feel happiest when I'm grateful for all the tiny little things that are good in my life. So feeling grateful and content and like I know myself and I can be myself.
Beautiful. That's actually a very thorough answer. And when it comes to you being, I mean, obviously you being a psychotherapist, is everyone always cautious talking to you because they think that you're always over analyzing them? It
That's
happens to me all the time.
Yes, that's actually where the title of the book originally came from, because it started in grad school when people, what are you doing? What are you going to school for? What are you going to be? And I tell them, and then it would be like, oh, are you therapizing me right now?
Oh, okay.
Right.
That's
Or, it'd be like, I need you to therapize me. I need you to work on me. And so like the word just always cracked me up because I'm like, that's not a word, but it
uh,
always made me laugh.
it's
So
original. Actually, very
it,
when
it
I read,
stuck.
yeah, very very original. Um, but do you want to say any concluding words to all the listeners on this podcast in terms of how do they keep themselves motivated to move on in the future, even though they're facing challenges? What should they tell to themselves to be able to say, you know what, I got this. I'm going to move forward no matter what, and I'm going to overcome all my challenges and hurdles, whatever the outcome occurs. So, what is the would say a word of wisdom would you like to give to everyone?
Yeah, that's a good question. When we're in those dark spaces and they feel big and overwhelming, and somebody just needs that motivation to go on and that hope, there's I like to remind people baby steps. The baby steps are what we don't change. There's homeostasis, so we don't change drastically overnight like we try to do the New Year's resolution and,
Mhm.
and be one person on New Year's Eve and a new person,
The next
the
day.
next year. Like, no, that doesn't happen. So it's the little baby steps and that all those little baby steps and that choice, remembering that we have choices in every moment, that choice to make those little baby steps each day, man, they can really add up. And if you make that choice to take that baby step each day, where you are now and where you're going to be in 6 months will be entirely different if you make that choice to take the baby steps. So one little baby step at a time.
Beautiful. So tell everyone, where can they get your book?
Yeah, Amazon. Therapize Yourself will be on Amazon October 5th, and you can kind of watch along, follow along my website, carrieleaf.com, or Instagram is Carrie Leaf Coaching.
Beautiful. Well, Carrie, thank you so much for attending my podcast today. I think your message and your content was very enlightening for all the listeners out there. And again, thank you so much for taking the time. And I hope that this podcast was able to be as enlightening for you as it will be for all of our listeners.
Yes, it's definitely been a good time. Thank you so much for having
Thank
me.
you so much. Have a good one.